So today we're here for the first Community Health Program Internship Poster Day, and this is where our student interns get to showcase what they've been doing all semester with their full-time internship experience. We invite the entire department, as well as Introduction to Community Health students, as well as our students who are going to be doing internship next semester to participate, just so that they can get a little bit of a preview of what the last semester of their program entails. So the university has a recent initiative to identify capstones across programs and allows programs to tailor that to their specific discipline. And so internship is a really nice example of what a capstone can be. And so we wanted students to be able to not only showcase what they did at their internship, but practice some really transcendental skills like formal presentations and poster presentations, communicating to lay audiences, as well as identifying strengths and weaknesses of an organization's culture or climate, as well as build skills that could foster development into what they want to be, their future professions. And so doing a poster allows them to do all those skills, but then also relay that information to others who are interested in this career field and get ideas of where maybe they want to intern, also have a preview of what's expected of them to make this experience a little less anxiety-provoking as they move forward. I hope students had fun during their internships. I hope that they are either validated in what they want to do moving forward, or maybe get some pivots in what they could do. I also hope it's an opportunity to network, so they're networking with professionals in the field within their organization, as well as outside in the Lawrence Douglas County community and Kansas City metro area. And they're also having an opportunity to network within the community health program. We've noticed that we typically tended to be a little bit more siloed, but this is an opportunity for seniors to be engaging with freshmen and make the program a little bit more of a community in itself. And so those are just a couple of things that internship provides for our students in addition to those skill building activities.
I did an internship at Favorite Healthcare Staffing, specifically within program evaluation. So after COVID, we saw a huge downfall in the amount of temporary healthcare professionals that want to work at hospitals and facilities. So my goal was to try to improve that and get more people working and to improve their experience through our company. And so these are a couple reports that I made and used to determine the effectiveness of the company and to find the areas that temporary healthcare professionals were not having the best experience within. Something that I learned through this is that there's a huge problem within cancellations, both on the client side and the temporary healthcare professional side, in the aspect of that people are canceling last minute, so then hospitals and facilities are being short-staffed because they don't have someone to fill that position as quickly, because it happens within sometimes an hour, sometimes 30 minutes. So this report right here can look at THP locations, temporary healthcare professional locations and clients locations to be able to fill those orders in a more timely manner. I gained lots of problem solving skills, lots of communication skills, and more data analytics skills to be able to create all of these reports.
I was able to intern with the Health Education Resource Office, also known as HERO, and they do believe in holistic health and that when you feel well, you do well. So what that looks like is prevention-based programs, one-on-one coaching, presentations, and other outreach events. Through that, they offer a variety of different services under sex positivity, self-management, tobacco, nicotine, alcohol and other drugs, as well as nutrition and food insecurity. And also under that, we do have CPR and the peer health education program, which is kind of what I was a part of. On the day-to-day, I was in charge of a lot of different things. A lot of that looked like bigger events like Pause for Pups, which was our animal therapy event that we had across campus, where we had our therapy animals, and it was just an opportunity to stress bust for students. And then we also did a lot of kit making, so that looks like Safer Sex kit making, and also our Safer Sex Express, which is a delivery service for those products that RAs can do. And then I had a lot of different presentations and tabling events that I did. So presentations would be usually on Hero, or sometimes I did do self-management, and then also same with tabling. I would do sex positivity, self-management, and Hero as a whole. My objectives were pretty clear for this internship. I was to provide health education, provide and promote overall well-being, health and well-being, and the biggest one was probably increasing the understanding of Hero, because not a lot of people know that Hero is a free resource for students. The biggest challenge I had was probably some negativity during tabling, but being able to kind of overcome that and just to turn it to a positive was a big aspect. And then a big success was I was able to create some products I am proud of. Up here, I created a volunteering infographic that kind of just goes over what it is to be a PHE, what volunteering looks like, different opportunities, and what some of those requirements are. And then I also created PHE tabling tips. When I first started, I had a lot of anxiety about tabling, so I created this to help future PHEs with tabling, and then some of those talking points that can be negative. And then I also created some PowerPoint presentations that I gave to a few classes on self-management and Hero as a whole. Overall, I learned a lot through this internship. I think the biggest thing I learned was you can serve your community and also serve yourself. So finding a career and an opportunity that allows for that is really important to me. And also just knowing what I want to do with my future now, being able to work in communities that really do need these resources and don't have them, and being able to connect them to those resources. And then I think the alignment with community health as a whole with this internship was quite large. We serve the KU community, specifically students, in those prevention-based programs in order to build a healthy environment. So I think just emphasizing that through both health educators and peer health educators that we're able to provide that in the KU community. We are a different approach than clinical care, but it is one that's necessary. And then also, this internship really did, I was prepared for this internship with the community health program. I think especially learning more about social determinants of health and health disparities was a big one that prepared me for this internship, because health does look different for every person. So being aware of that through the internship was essential.
I interned with Autism Services of Kansas. They are an applied behavioral analysis company. So they work with specifically young children, ages 3 to 7 is typically our range. Sometimes we get one a little bit older or a little bit younger, just kind of depends. But all of my kids are between 3 and 7. I worked as a registered behavior technician. I got certified, and I provide that individual one-on-one therapy with the kids. I'm not the one that develops the programs that we use with them. I have a supervisor that comes up with the programs, and then I'm the one that implements them. And I get a lot of supervision with that. As part of my internship, I also did a bunch of presentations. I did one with our consultants where I talked about using behavioral models with the families that we work with in parent training. And then I did one for the police department in Jefferson County where we brought these handy little bags from Ben's Blue Bags. Can you see that? And they have some items in there that are just helpful, would be helpful for police officers to have in their patrol cars. They've got communication boards, headphones, fidget toys, things that would be really beneficial in an emergency situation where maybe the person's overstimulated or understimulated, or they could be experiencing an emergency themselves. My big takeaway is that it's really, really important that we get these kinds of services out in the community. There, for ABA especially, is a lot of misconceptions about it, and it can be seen as something negative, but there's been a lot of research lately in the recent years and a lot of changes to the programs that have made it a lot more people realize how important it is, and it is considered the top treatment for people with autism. I was kind of at a loss as to where I was going to go after I graduate. Wasn't sure career-wise what I wanted to do. I've been kind of between working with people who have struggled with substance abuse and then with children with disabilities. And doing this internship, I've really realized that I love working with kids, and I have a great time. And so I think it's really going to help me move towards that path in my future.
Okay, so this is my poster. I did my internship with DECA. DECA is a outpatient, is a nonprofit organization that offers community and social outpatient services. We focus on mental health, substance abuse prevention, fostering adoption, and also traffic safety. DECA's been around for about 50 years, and as the years keep going on, we just keep growing. Even though I did my internship with DECA, I was an in-school based prevention specialist at Perry LeCompton. So basically, I focused on substance abuse prevention with students, staff, parents, and just people in the community talking about drug and alcohol abuse and how it basically harms your body. And we also discussed alternatives and ways that we can create healthier relationships with ourselves and not abusing substances. So basically what I did also one-on-one intervention with students where with students that are struggling with addictions, where we just got down to, what's going on, how can we stop, vaping or smoking or drinking alcohol, and how can we build a better relationship with ourselves and take care of our mental health where we don't, abuse substances. I was also a YEP sponsor. YEP stands for Youth Empowerment and Prevention, and it's basically a student-led program where students in the high school and middle school are leaders that talk about substance abuse, suicide prevention, mental health, bullying, being kind to one another. And so they just try to collaborate with other students around the area where they focus on a campaign to present to the school and implement in the school in that semester. Every month I also sent out a mental health and prevention newsletter based off the awareness that was surrounded that month. So September is Suicide Prevention Awareness Month. So we also did, we would do like a suicide prevention activity where everyone wore yellow for the whole month in support of the awareness. And then that month I also gave out suicide prevention presentations to the high school and middle school to educate them more on that. And then I just implemented other activities, like safe activities for the students to participate in. So every Wednesday is game night, and then pause for pups, and then after school activities that are just really fun for students to participate in. So they're just not, they have a safe, space for them to, after school. If they're not doing sports, then they can come like play games or, watch movies and have fun, that kind of thing. But yeah. I can run through my challenges and lessons here. A challenge was creating space for buy-in. The area in Perry Compton is very rural, so I needed to make sure that I knew what I was talking about. I was credible in my material. I knew what I was talking about, and they can trust me enough to, give them credible information and relay that information to them. Lessons learned is that everything needs to be documented. So when I was giving presentations, I needed to document everything, how many students were in the classroom, how many were engaged, and what I did, what lessons I gave. And then I learned this lesson is that little by little, try to build on relationships with those that you feel a disconnect with. Working at a school, there's going to be times where you're saying good morning to students and they don't say anything back to you and walk right past you. And that's okay. you know, but just make sure that you're kind, that you show up every day. And then a psychology tip that I learned is that people like hearing their names, so make sure that you remember names. So that's what I did.
So I did my internship at Britain Development Center, which is a child development center in Kansas City. They provide a very wide range of services, primarily special education preschool classes, and then the therapies that would go along with that. So speech, occupational therapy, physical therapy, aquatic therapy, and feeding. So I got to see a lot of different things. I feel like I can't even begin to explain all of them, but some of my favorites, I loved being in the classroom. I think watching the kids interact with each other, learn from each other, their ability to just like learn routines was really fun to watch too over the course of the semester. I also really enjoyed feeding therapy. I wasn't quite sure, I'd never seen that before. And I got to see it in both like a group setting and a one-on-one setting, and I thought both were really interesting. A lot of sensory issues that come with feeding that I wasn't totally thinking about. The facilities in general were really cool. They had like a lot of sensory integration things. So they have like a sensory pool that had special lights. Both the pools that they did aquatic therapies in were heated to specific therapy temperatures for kids, which was super cool. They also had this harness system that went around most of the building. It was in all of the classrooms, definitely, where kids could get hooked up and move about freely in the classroom if they had like mobility issues. So that was super cool. It was just, everything was state of the art, really inclusive towards all of their kids. It was great to see like the families build relationships with each other and the parents getting to like go get coffee or lunch or things and talk about that. Their shared experiences with their children was really cool. I feel like I learned a lot. I knew I wanted to go into occupational therapy. I thought I wanted to work with kids, but I had not worked with them previously, so this was definitely affirming in my idea that I did want to work with kids. This is something I'm really interested in. I feel like I've learned so much about how much kids can surprise you. They are like obviously certain expectations of kids, but they just learn really quickly. And